She had been on Warfarin for 2 years. She knew the rules. She took a pill every evening without fail. She went to her inner checkups every few weeks like clockwork. Then, in January, she decided to eat healthier. She started adding a big spinach salad to her lunch every day. Dark, leafy, full of nutrients. Exactly what everyone says seniors should eat more of. 3 weeks later, her inner check came back dangerously low. Her blood was clotting too fast. The medication protecting her from stroke had quietly stopped working. Her doctor was baffled. Her dose hadn't changed. She hadn't missed a single pill. It took another appointment and a very careful conversation about her diet to find what had changed. If you take warfarin, also known as Coumadin or Juntovan, there is something about leafy green vegetables that your doctor may not have explained clearly enough. Not because they wanted to leave you in the dark, but because the full picture is more nuanced than a simple warning. And the nuance is the part that actually keeps you safe. By the end of this video, you are going to understand exactly how vitamin K and warfarin interact inside your body, why the advice most seniors received about leafy greens was incomplete, and the one eating habit that protects your inner better than anything else. Warfarin is one of the most prescribed blood thinners in the world. Millions of people take it, most of them over 60, for atrial fibrillation, deep vein thrombosis, pulmonary embolism, and heart valve replacement. When it works correctly, it is genuinely life-saving. Research shows it reduces stroke risk in people with atrial fibrillation by around 68%. But warfarin has a reputation for being one of the most finicky medications to manage. And the reason comes down to a number called INR. INR stands for International Normalized Ratio. It is a measure of how long it takes your blood to clot. For most people on warfarin, the target is between 2.0 and 3.0. Too low and your blood clots too fast, your stroke risk goes up. Too high and your blood is too thin, your bleeding risk goes up. Staying inside that narrow window every single week is the entire game of warfarin management. And what you eat specifically, how much vitamin K you eat, moves that number directly. Here is how it works in plain English. Vitamin K is an essential nutrient. Your liver uses it to produce the proteins that allow your blood to clot. Warfarin works by blocking vitamin K's role in that process. It does not remove vitamin K from your body. It interferes with how your liver uses it. Think of it this way. Vitamin K is the fuel that activates your body's clotting system. Warfarin is the dial that controls how much of that fuel gets used. Your doctor set that dial at a very specific position based on how much vitamin K you typically consume each week. Now, what happens when the amount of vitamin K you eat changes significantly? The dial no longer matches the fuel level. More vitamin K suddenly in your system, your INR drops. Your blood thinner is less effective. Less vitamin K suddenly in your system, your INR climbs. Your bleeding risk increases. The medication didn't change, your food changed, and your body felt it. Here is what most seniors on warfarin were never told clearly enough. For a long time, doctors told warfarin patients to avoid leafy greens, avoid spinach, avoid kale, avoid broccoli, avoid Brussels sprouts. The reasoning seemed logical. Vitamin K affects warfarin, so avoid foods high in vitamin K. But in 2021, the American College of Chest Physicians updated its guidelines with something important. They stated that dietary vitamin K restriction is not recommended and may be harmful. Why? Because a study published in the journal Blood found that patients who intentionally restricted vitamin K had 37% greater day-to-day INR variability. Read that again. Avoiding vitamin K made their INR less stable, not more. Their bodies became hypersensitive to even tiny fluctuations. A slightly larger portion of broccoli on Monday, a green tea instead of regular tea on Wednesday. Small, normal, unavoidable dietary variations, sending their INR swinging in ways that were genuinely dangerous. Now, before I show you exactly what to do with this information, I want to say clearly, this is for educational purposes only. Warfarin management requires regular INR monitoring and a close, ongoing relationship with your anticoagulation team. Nothing in this video replaces that. What it does is give you the context to have a better conversation with them. So here is what the evidence actually says. You do not have to give up leafy greens, not kale, not spinach, not broccoli, not Brussels sprouts. The problem was never the food. The problem is inconsistency. And now I'm going to show you what consistency looks like in practice, which foods deserve the most attention, and the hidden vitamin K sources in your kitchen that almost no one on Warfarin has ever been warned about. The single most important word for anyone on Warfarin is not avoidance. It is consistency. Your anticoagulation team calibrated your Warfarin dose around your typical weekly diet. If you eat a cup of spinach every Tuesday and Thursday, your team can set your dose to account for exactly that. The danger is not the spinach. The danger is eating 2 cups of spinach this week, none at all next week, and a large kale smoothie the week after. That irregular pattern is what sends INR swinging between too low and too high, sometimes in the same fortnight. This is exactly what happened to the woman at the beginning of this video. She had been eating very little vitamin K for months. Her dose was calibrated around that. Then she added a large spinach salad to her lunch every single day. The vitamin K load shifted. Her INR fell. Her stroke risk quietly climbed. Not because spinach is dangerous, because the change was sudden, large, and her doctor had no idea it was happening. Now, here is the simple way to think about which foods deserve the most attention on Warfarin. You do not need to memorize a chart. You do not need to measure micrograms. There is one visual cue that tells you almost everything you need to know. The darker the leaf, the higher the vitamin K. Kale, cooked spinach, Swiss chard, collard greens, and parsley sit at the top. These are your highest attention foods. A single cup of cooked spinach can contain over 800 micrograms of vitamin K. The middle tier broccoli, Brussels sprouts, cabbage, romaine lettuce, still meaningful, still worth keeping consistent. Lighter colored vegetables, cauliflower, carrots, tomatoes, onions, potatoes carry far less vitamin K and are unlikely to move your IN significantly in normal portions. So the practical rule is this: the darker the leaf, the more it matters that your portions stay consistent week to week. Not that you avoid it, just that you eat roughly the same amount in the same way on the same days. And if you want to change that pattern, if you want to add more greens or cut them back, tell your anticoagulation clinic before you do. They can arrange an INR check to keep you safely in range through the transition. Now here is the section most Warfarin patients have genuinely never heard. Vitamin K is not only in vegetables, it is in your cooking oils. Canola oil, soybean oil, and to a lesser extent olive oil all contain meaningful amounts of vitamin K, which means that salad dressings made with these oils, mayonnaise, and many bottled sauces contain more vitamin K than most people ever realize. A large restaurant salad with a generous canola oil dressing can deliver a significant and unpredictable vitamin K load, especially when the portion varies every single time you order it. Green tea is another one. It contains small but consistent amounts of vitamin K. Not enough to cause dramatic swings on its own, but enough that switching from green tea to black tea, or starting and stopping it, is worth flagging to your team. And multivitamins. Many standard multivitamins contain vitamin K. If you recently started or stopped a multivitamin, even one you have taken for years, the change alone can shift your INR. Always tell your anticoagulation team about any supplement change, including the ones you think of as harmless. Because on Warfarin, harmless and invisible are not the same thing. Here is the one sentence that matters most from this video. On Warfarin, the goal is not to avoid vitamin K. The goal is to keep your vitamin K intake consistent week to week so your doctor can dose your medication accurately around it. In practical terms, that means three things. Do not suddenly add large amounts of leafy greens if you rarely eat them. Do not suddenly cut them out if they have always been part of your diet. And if you want to change your eating habits, tell your clinic first. They can schedule an INRA check and adjust your dose safely. That is all. No complicated food diary, no giving up vegetables, no bland, joyless eating, just consistency. And one honest conversation with your care team. You are not doing anything wrong by wanting to eat healthier. That instinct is right. It just needs one extra layer of information, the layer that makes sure your medication keeps protecting you while you do. That is what this channel is here for. Every single week. The specific truth that makes your good choices even better. If this helped you today, subscribe. Every week, I bring you one thing your doctor didn't have time to explain, and it is always something you can actually do something about. Before you go, we have covered grapefruit and statins, salt substitutes and blood pressure medication, and now vitamin K and blood thinners. Next week, I am covering something completely different. Not a food that interferes with your medication. A food that tens of millions of seniors over 60 are not eating enough of, and it is silently causing them to lose muscle every single year. Not just weakness, not just fatigue, actual muscle tissue. Disappearing, and the most surprising part is not which food it is when you are supposed to eat it. Because most people eat it at the wrong time of day. And that one timing mistake means their body cannot use it properly. That is next week. Don't miss it.